Yeah, today's subject is social anxiety. Okay, social anxiety has become, a common issue now. Okay,
Mm.
and that arises since the childhood. And there are different causes of social anxiety. First is what you call genetic, and second, the environment and the atmosphere where a kid is brought up.
Mm.
That is one potential reason. Second potential reason, and there are some, you know, some situation also which trigger for the anxiety, right? Like meeting when meeting unfamiliar people, or uh, there are symptoms, different symptoms like talking to people at work or school, or when a student is called to speak in the class, then also this symptom can be observed. Okay, or using a public restroom during that time also this anxiety can be spotted, experienced, or being seen uh, while eating or drinking, during that time also one feels anxious, or when someone is called to perform in front of others, in front of public, so during that time also. Okay, and this anxiety has different effects on the body, mind, and physical, emotional, and behavioral symptoms. These effects can be observed. Okay, physical symptoms are like sweating, trembling, or nausea, or increased heart rate, or sometimes mind becomes blank. These are
Mm.
physical symptoms, and also feeling of panic or panic attack is also a symptom of social anxiety, or fear of experiencing anxiety, or anxious, feeling anxious in front of others, and a fear of judgment from others. This is also kind of social anxiety's symptom, and feeling very self-conscious, being feeling self-conscious, embarrassed, or awkward in front of others. This is also a sign of social anxiety. And you can see that these symptoms are very common, and uh, these are these are observed in the people, most of the people, and having difficulty in speaking in the public. What do you call public speaking fright, or also stage fright? They also called stage.
Mm.
You know, and stiffness of body and soft voice during social interactions,
Mm.
sensitivity to criticism, low self-esteem, and what you call negative self-talk, negative, or inferiority complex. And these symptoms can be observed in daily life, like at school, during in childhood at the school, and during a young age at the work, and also in the relationships that can be observed. And if that is not treated properly, then that affects lives. So mindfulness helps in this. In addition to mindfulness, some people go to psychotherapists. Okay, and psychotherapists uh, conduct some therapy like CBT, okay, or interpersonal therapy, or um, psychodynamic therapy, or family therapy. So there are different therapies they do. And now mindfulness has also come in their stream of therapy. Mindfulness is also used as a therapy. In addition to these psychological treatments, uh, they give some medications, also antidepressants meditations, and anxiety attack. So this is also, since this is also kind of anxiety, so they give some medications. And but that is not safe, and that is not the permanent solution. So mindfulness can also be practiced as a treatment, or as a healing system for the social anxiety. And in mindfulness based interventions for social anxiety, there are different types of techniques of mindfulness, like uh, sitting meditations, what you call formal meditations, where you use sounds also, as sounds, different sounds, and the traditional mindfulness practices, what we had learned in the first class, mindful world, moment to moment awareness. You have to train to be in the moment, present moments. Okay, in the present moment, you have to teach to practice non-judgmental attitude. Okay, you have to teach some kind of detachment and forgiveness, acceptance, you unconditional acceptance, and learn with beginner's mind. So
Beginners.
that is the basic mindfulness. Okay,
Seven principles.
yeah, certain characteristics.
Sir, can grounding exercises be helpful?
Yes, yes, yeah. So these are the natural therapy, and these practices, these tools of mindfulness have uh, profound effects. Breath awareness is also very powerful. Breath, breath meditation, or observation. Rain technique also, you can use rain technique. So all of the techniques you have learned, you can use any of them. Rain technique, and uh,
Stop.
stop, body scan. Body scan is more powerful.
But sir, we have to prepare the individual script for body scanning, right?
Yes, yes, yes.
It has
And
customized.
customized, because there is a standard, but you can customize that. And also according to situations, according to the time, you can edit, because you are creative enough, so you can be adaptive in guided meditation. When you'll guide for the body scan, you can, but the fundamental practice, you start from the toes, and you move upward. Okay, from toes to uh, feet, ankle, heels, and legs, knees, thighs. You move upward.
Okay.
So you can scan all the parts. You can go randomly also,
Hmm.
parts of the body, you scan that.
But which is the more prominent one? I mean, the more effective one. It is from coming from bottom to top.
Yeah, normally in mindfulness body scan, we use from the bottom.
Bottom to top.
Yeah.
And sir, in this, every organ has to be named, or it is okay if we miss out.
Yes, actually, that depends on the time also. If you have enough time, then you can scan the entire body. And if you have, but normally you scan all the major parts of the body,
Okay.
like feet, legs, thighs, buttocks,
Hmm.
back, belly, chest, shoulders, arms, elbows, wrists, hands, then neck, face. On face, if you have time, then you can go in detail, like lips, cheeks, nose, eyes, ears, forehead, scalp. Yes, you can go in detail. Otherwise, you can scan the entire face,
Hmm.
and then entire face, skull, that kind of thing.
Hmm.
Again, if you have time, then you can go into the internal organs also.
Hmm.
Internal organs are like heart, lungs, stomach,
Hmm.
pancreas, kidneys, liver. You can relax them, you can heal them also.
Okay. So depending on, say, for example, I have like few people who are suffering from chronic pain. So
Mhm.
to name it, they're suffering from rheumatoid arthritis,
Mhm.
and that too very severe one. Like, and the major problem is in the ankle part, feet.
Mhm.
That goes completely red, and so can I treat them with mindfulness?
Yes, yes. Mindfulness body scan can help
Hmm.
uh, in alleviating the pain and
Hmm.
decreasing the pain intensity.
Hmm.
What happens in mindfulness in body scan? You first scan that part, and if you find pain or discomfort or any such thing, you breathe into that part, breathing into that, and breathing out from that.
Okay.
That works, that helps. Breathing into the affected area and breathing out from that area.
Hmm.
This is first part. Second part is just watching and accepting that pain in the body. That yes, there is pain, and that is okay. What happens normally? We try to resist. People
Hmm.
try to resist. People try to combat that. People try
Hmm.
to remove that forcefully.
Hmm.
Don't accept the pain. Therefore, that makes one feel more that there is pain.
Hmm. Hmm.
But the moment you accept, then you reduce the intensity of that pain.
Hmm.
So acceptance is also a powerful tool of mindfulness. Accept.
Hmm.
Okay.
Okay. So.
So body scan. The body scan also can help in social anxiety issue. And then breath meditation or deep breathing meditation, breath awareness meditation or mindfulness of breath also can help with this. And in this breath meditation, you can guide for in sitting posture or in lying posture also. And you can ask to
Hmm.
count the breath. So uh, either you can speak or you can ask question, but since they are not able to use, so when you are guiding, then you can count that
Hmm.
five counting with inhalation, five counting with inner retention, five counting with exhalation. Like 1, 2, 3, 4, 5. Now hold the breath. 1, 2, 3, 4, 5. Now exhale till 5 count. 1, 2, 3, 4, 5. In that way.
Okay.
This is when you will be guiding. But uh, if there is no teacher and there is social anxiety attack, then you can advise that just count yourself and don't hold. Just inhale, breathe in, and breathe out. Deep breathe in and deep breathe out. And that really helps in anxiety attack or any kind of dispositions or imbalances. If you breathe deeply, you are settled. You are
Hmm.
grounded. And all these techniques will reduce the severity of the symptoms or the effects of social anxiety. And before going into the public or before going on the stage or before coming in front of people, if one breathes, one practices even the stop technique also. Stop,
Hmm.
very quick technique, quick practice for
Hmm.
3 minutes, only 3 minutes. So within 3 minutes or within 1 minute only, you can just take deep breath and you can go into the public and you can start speaking or you can start performing in public.
Hmm.
Okay.
Right, sir.
So this is this is mindfulness in social anxiety attack issues. Okay.